To.
You are listening to.
You're listening.
Yo, what up, bitches? You're listening to Hey Poopy Podcast. Get your shit on.
Hey, Poopy, how you doing? Hey, Poopy, how you doing?
I'm just, trying to find a place with like-minded people to talk about like-minded things about me, about poop and stuff.
Hey, Poopy, how you doing? Hey, Poopy, how you doing?
Oh man, what's this right here? Is this a podcast about poop?
And now, the Hey Poopy Podcast with Dave and Ellen.
Hey everybody, we are back on Dump Day.
Yes, we are. And this is the Hey Poopy Podcast with
Dave
and Ellen. And this is episode 97, but it'll always be number 2 to us, our favorite number.
Yes, it is.
And we have a very, very special guest. Not just one, but 2 doctors have now officially been on this podcast who have seen my butthole. It's my colorectal surgeon, Dr. Carmen Fong.
Welcome.
Thank you for having me.
Yes,
and Dr. Fong actually knows Dr. Goldstein, so...
Yeah, I worked with him when I first started training. When I was an intern, he was one of the first surgeons I worked with.
Oh, wow.
Oh, cool. Mm-hmm. So do you guys trade butthole pictures back and forth?
I think the beautification of buttholes, he taught me everything I know. So.
Nice.
He gave you a real appreciation for it.
Yes.
Excellent.
Yeah. For the back end.
Yes. And before we go into more about Dr. Fong and her incredible work, we always check in our guests first. So Dr. Fong, how have you been pooping recently?
I've actually been pooping pretty regularly, and I'm really proud of that fact.
Nice.
That's awesome.
Pretty regular every morning, somewhere between 7 and 8, or an hour after I wake up, and that's the goal. A daily bowel movement.
Yeah, completely.
Do you just go?
Call me Carmen, though. By the way, call me Carmen.
Oh, sorry. I feel like you're such a you're so. I'm like put you on a pedestal as being somebody who's helped me with my butthole problem. So I feel like it's almost disrespectful to call you by your first name. So if you gave me permission, I will. But
I give you permission, absolutely. At home, I am just Carmen, or hey you, anyway.
Hey you. Hey you.
And on the Bristol stool chart, what number are you making?
I actually think I'm right between a 3 and a 4, pretty regularly.
Perfect.
Yeah. And it's funny, I was thinking about how most of my patients actually don't know what the Bristol stool scale is. So, if I said a 3 or 4, they would have no idea what I meant. But, like a normal soft bowel movement.
Nice. How many times are you going a day?
Once.
Okay.
Once a day.
Nice.
Yeah. Once, maybe sometimes twice on a bad day, but
I think that's a good day.
Or maybe that's a better day.
Yeah. Nice.
It's just the location and what you're doing at that time during the second one that can make it a bad situation.
A second bowel movement during surgery makes it inconvenient. So.
My Lord.
That would be. That would suck.
I can't even imagine.
Yeah. So I always go before I go into the operating room. I mean, that's.
Oh, yeah, cool. You got to do that.
Yeah.
You can't be like, I'll be right back.
Yeah.
Let me just leave these tools on top of you real quick.
Yeah. No, the patient won't notice. He's asleep.
That's true. So you could just go right in there.
Oh, God. We haven't gotten to that portion of this.
Oh, okay.
Oh, my Lord. What about you, Dave? How's it going?
Pretty good. I went to dinner last night and we had this really good Thai food. My friend just moved into a new apartment, so we went to go over there and check out her new place. And we had dinner outside, and it was really good and not as spicy as I thought it was going to be. It was like northern Thai, which usually is a lot more spicy. Mm-hmm. But it was good. It was delicious, and I had a normal poop this morning. A little on the looser side. I had my anxiety because I went for my morning run, my long morning run this morning, so I'm always it's in my head because I just don't want to go do it, but I'm like, let me just go run.
That's amazing. Long runs always make me poop too. Do they help you?
Yeah, I mean, well, for sure they make me go to the bathroom, but it's more like before. I go to the bathroom a lot before I run, and after I get home, it's just kind of whenever. I'll go again later today.
Anxiety that he might go while he's running.
Well, it's more like if I don't, I feel like if I don't go to the bathroom, then yeah, it's gonna be a problem. It's more like in my head, like I need to like make sure that I get everything out because it's like a long run. It's like you don't know, and I didn't even go that long today because my ankle's been bothering me, but. It was enough where I was like, Jesus Christ, I got it. It's just so normal. I don't even think about it. I'm like, I have to go to the bathroom and then just do my thing. And then I come back, I'll just go again. Usually, like, I've never actually shit my pants while running. I've come very close. But that hasn't happened in a really long time. But if I eat, like, spicy food or, like, spicier food, I like to make sure that I'm, like, cleaned out.
Yeah, I remember.
No,
go ahead.
No, you go ahead.
No, Carmen, I mean, Dave, I remembered that when you and I ate Thai food maybe like a year ago, within 30 minutes, you were on the toilet. So
yeah, it depends.
That must have been very good Thai food last night.
Excellent.
That it was more binding.
It was excellent Thai food. Very good. A place called Clorm, which is the most 90s noise rock band name ever. But they were very good. It was very good food.
That's hilarious.
I was just gonna say. Sorry, I was just gonna say that people like pooping their pants during marathons is totally a thing I've seen, and that is also my worst fear. But because like the running increases your motility, so it does happen.
Oh yeah, and the worse it gets, like you can't like you want to be like I'll just run fast enough so I can get to the bathroom, but that just makes it worse. So you wind up just running a little bit slower and all awkward. But anyway, Ellen, how was your poops?
Yesterday I had a photo shoot and I did not poop at all of yesterday because I have anxiety belly where it like holds it in. And so last night I was like, okay, it's been a full 24 hours. I can't live like this. So I was like, well, I'm going to take a Swiss Chris before I go to bed to make sure things come out properly tomorrow. And they did this morning. So I was drinking my coffee, went into the bathroom. I wouldn't say it was like more like a 4.5, 5 on the Bristol stool, a little softer, but at least it got out. I hate constipation. But I have a funny thing to say. My model yesterday was telling me she was constipated her whole life. She's only 21. She was born in 1999. So get ready to feel older.
Yeah.
And she told me that when she's constipated, she puts her fingers in her vagina and pushes on the back side to push the poop out, and that works for her. I have heard that before. I don't even know if that's physically possible. I was telling her to get a stool to maybe straighten that out for herself.
Yeah.
But that was shocking.
That seems a lot of work.
So obviously I'm not here to give medical advice, but that is a thing. That is a total actual thing. Yep, you put pressure in your vagina or on your perineum and it helps you stool. Usually it's people who have what's called like a rectocele or like a small kind of redundancy, like a little floppy rectum, and you actually push to help push that stool out.
Floppy
She's really
rectum.
young to have that. Like normally it's an older woman.
I like that.
But that is a thing.
Floppy rectum.
Correct. Yeah.
Wow, thank God this happened yesterday, and we have an expert on today. And yes, and we should state, just because Dr. Fong is a doctor, nothing that we say during this entire podcast will you any taking for medical advice. Make an appointment with Dr. Fong and talk to her privately in her office. That's the way to get medical advice. Never get this from a podcast.
100%. I agree.
Agreed.
So now that we've checked in, Carmen, tell us a little bit about yourself.
Yeah. So I was born in Hong Kong, and then, we moved to Canada when I was pretty young, like 4 or 5 years old. And then we moved to Connecticut, and then I moved back to Hong Kong. So I actually grew up in Hong Kong for most of my life. And then I came back to New York for college. I went to Sarah Lawrence College and then went to medical school in Michigan and then came back to do my training. And I've stayed here ever since. I've always known that I love New York, and I had always wanted to come back even when I was little.
Oh, excellent.
Nice.
Yeah. What years were you in Connecticut and what town?
I was in Stamford, Connecticut for, I was 11 or so. So 2000, no, shit, no. 94, 95, something like that.
Okay.
Yeah.
I grew up in Connecticut, so I was just curious if we were close. We were semi-close, the same
Where
town,
were you?
but I was at Easton.
Oh, okay. Yeah. Yeah, I was only there for a year, but most of my life was either in Hong Kong or Canada, and now actually over a third of my life I've been in New York. So,
oh wow,
yep, I'm both American and Canadian.
Nice.
Ah, that's the best.
I have a friend, the same thing. He's Canadian. Well, he's Persian. Then when the Shah, that whole thing went down, they moved to Canada. So he's Canadian. He's Canadian, American, Iranian, and he married his wife, who is from Connecticut, tying everything in here, who is also Greek. So they have like a gazillion. It's like EU.
It's pretty diverse.
Yeah, it's pretty nuts. Yeah. So they have like Also, this is not a show about different parts of the world, but he's Greek. Sorry, she's Greek and he's Persian, which I didn't know that was like a whole thing way back in the day. Those two people, they did not get along. So anyway,
No, I'm keeping my options open in case I need to flee in a couple of weeks. So.
Yeah, man. I mean, they could be like, let's just go to Greece.
Yep.
Or like wherever, Canada. But anyway, sorry. But very fascinating. I'm glad you got to travel the world like that. It's a young age and back and forth.
Yeah, I'm super appreciative that my parents, took us around everywhere.
That's very cool.
And then my big question for you is, when you went to med school and then you filtered down into what your specialty was going to be, how did you pick the butt?
Yes. I ask myself this every single time I'm disimpacting someone. I'm like, how did my life come to this? And often my patients ask me this, just like moments before I do a digital rectal exam. They'll be like, Dr. Fong, why did you choose proctology? But to be honest, I actually went into colorectal surgery because I wanted to treat colon cancer. Colon cancer for me is, it's a very curable disease when it's in the early stages, and surgery is curative. So being like my personality, I really wanted to be someone who could be like the definitive answer for something. And that was one of the areas I found, you could say, hey, I cured cancer in this one very, very small area. The other thing, though, is I found that my anal rectal patients, like the proctology patients, are super, super appreciative. And they're very, very grateful. And they're always very satisfied that someone is like listening to their, butthole problems and like listening to them describe their poop, which for me is like, right now it's just like every day. Yeah.
It's like so run of the mill for you now.
Yes, exactly.
It's probably still like run of the mill for you now. You're probably like, oh, whatever.
No, it's so funny because patients will be like, oh, doctor, I'm so sorry. I'm coming in and I have to tell you this, blah, blah, blah. And I'm like, listen, you're probably like the 12th person today who's telling me about their butthole problems. So don't be embarrassed at all. And that's great for me. Like, I really want to try to normalize the whole thing and be like, it's okay. We're talking about our other body parts. You can talk about your butt.
Completely.
Nice.
That's why we did this podcast. We started it off as like a funny way to talk about poops and farts, and then we were like, we really need to talk about butthole health.
And I love it. Yeah.
Yeah. And also, like, with Chadwick Boseman dying recently in his early 40s of colon cancer, and him being such a big celebrity, I told Dave, I was like, we really should make this our stance for the podcast. We should be all about maybe even petitioning and getting people to sign up that insurance companies should be doing colonoscopies at a younger age. And because you even were saying that there's a huge spike in much younger than 50, because insurance companies only start at 50 unless you like have serious blood in your stool. Yep. And like, it should be like a pap smear for women, how they were tested once a year to make sure that they didn't have early cancer cells on their cervix. It should be the same for the rest of us.
Yeah, no, I totally agree. And so I'm involved in a couple of advocacy groups that have been trying to get earlier cancer screening for people younger than 50, because, like exactly like you said, right now we're only doing colonoscopies on people who are symptomatic, like have pain and bleeding. And by then it's actually like a little bit too late, because if you're having pain and bleeding, it usually means the tumor is pretty large and has progressed. And so we're trying to figure out if we can get cheaper screening, like even just do a Cologuard in people between the ages of 25 and 35 and start a little bit earlier.
Right.
You have to point us in the direction of some of those advocacy groups, because I think that Dave and I should really be like either putting it on our website or also bringing an awareness to that, because I know you would be a good jumping off point for us. I think that should be our stance.
Absolutely. One of the ones I love right now is Fight Colorectal Cancer, Fight CRC, just because they've done such a good job with like even social media and like visibility.
Amazing. Amazing. And you recently did, I've been calling it a mini colonoscopy.
Yes.
But that's not the technical term.
Yeah, a flexible sigmoidoscopy. So that is, so in patients who aren't going to get, insurance clearance for the entire colonoscopy, you're younger than 50, you're not having the right combination of symptoms, most of us can do a flexible sigmoidoscopy in the office, and that's not so without general anesthesia. So that's a good thing. Literally, it just looks up into the first part of your, sigmoid and rectum. And that's where most of the, diseases are going to be found anyway. So it's a good way to screen at least and say, hey, there's nothing, abnormal in here. If you continue to have symptoms, we do the full colonoscopy. But at least we've ruled out that part.
Nice.
And I saw 3 colorectal people in the past about year and a half. One woman, she wanted to ban my hemorrhoids. I saw Dr. Goldstein, but kind of more for the podcast. It wasn't like a proper office visit.
Right.
And then I saw you, and I really appreciated that you didn't want to ban, because the first doctor said banning. The second one, Dr. Goldstein, was like, don't do that because you'll get scar tissue and it could have more problems in the long run. And so I was like, this is why everybody should always get second and or third opinion on stuff. And then you went so far, it was like, no, there's other things we can do, and let's actually make sure, because erectile itch and that and the way I was bleeding when I first made the appointment with you, which we think was a fissure, which is a rip on the butthole. But the way that you were talking, you were like, no, let's do one more test to just really make sure. And that put my mind at ease.
Yeah. No, I'm glad. I really think that, when you listen to patients, almost 99% of the time, they actually tell you exactly what you need to know just from the way they're describing their symptoms. So, if they're saying a sharp tearing pain versus a dull ache, and then if they're saying, I had pain before I pooped or pain after I poop, all those things kind of start steering my mind towards the right diagnosis.
Right. What are the most common things that you treat or see? Or is it kind of all over the place?
Yeah, in all of surgery. I would say right now, hemorrhoids and fissures are probably the most common. I do a lot of anal fistulas, which are kind of like a little tract between your anus and your, butt skin. And so you can have a little bit of pus and debris that builds up in there. But fissures and hemorrhoids, fissures, first of all, are caused by, stress and lack of sleep and drinking too much coffee and having low fiber diet. And so I've actually seen an increase in these in the past 6 months with people being stressed out during COVID and stuff like that. Yeah. Literally everyone's coming with a fissure. And then they kind of go hand in hand with hemorrhoids, which, again, caused by almost all of the same things. And then a little bit of straining when you have a bowel movement. So when you have those in combination, it can be pretty painful and pretty bloody and pretty scary.
Wow.
And as we've learned, hemorrhoids are something you're born with. A hemorrhoid isn't a problem. It's when it gets swollen and it stays swollen is when it's a problem.
Yep, absolutely. So everyone is born with the same hemorrhoidal columns, but it's just a matter of if they get swollen and they start to bleed or they start to hurt.
And they can swell on the outside of your rectum, and they can swell on the inside of your rectum. Because I even had one doctor, a primary care physician, go, there's no such thing as inner hemorrhoids. And I was like, what?
Yeah, no, I know. So actually, I think I've told you this, but there's external hemorrhoids and internal hemorrhoids. And I get all these primary care doctors who I love them to death, and they're great doctors, but then they'll tell patients, oh yeah, don't worry, just go to Dr. Fong, she'll ban your hemorrhoids. Almost 100% of the time is this not the case, because if you have external hemorrhoids, the ones that are on the outside that you can see, they tend to hurt more, but they don't bleed. So you can't bend those because it's just like a little piece of skin. If I like banded like your cheek or your ear, like you would hate me forever. Internal hemorrhoids, they tend to bleed without pain. Those are bandable ones, but most of the time they're not big enough to band, because if you can't see them, you probably can't band them. They actually have to be almost like this polyp looking, like mushroom looking thing before they're like ideal for banding. But in the meantime, you know, we treat it with all these other conservative ways, like fixing your diet and exercise and behaviors, and yeah, there's other things.
Oh, nice. The whole banding thing. The whole banding thing just seems so like insane to me. Like just the whole like, I'm like that's an option. Like, and like who thought of that? Like that's just like little tiny rubber bands they make for them.
Yeah,
like,
and it's been around for almost like 30 years or so. Is actually one of the first treatments. You literally take a little, almost like a little slingshot looking gun thing, and it fires a little tiny rubber band just around the hemorrhoid and squeezes it off. That's how it works.
Oh wow!
It seems barbaric. It does work really well, but like I say, only for a certain type of hemorrhoid. Yeah.
I just imagine you with like little tiny like like little tiny scissor type things that you just put over it. I'm like, that must be like the worst. That'd be an awful day, I feel like. Yeah. Like, it's going to take me forever to band all these.
Yeah.
How many we got left today, guys?
We also want to talk to you about other stuff besides just like the hemorrhoid problem. But do you believe in or have you heard of fecal transplants, and what do you think about them?
Yeah, I actually believe in it. And, you know, the evidence is pretty good for fecal transplants in certain diseases, right? So, like right now, the main thing is for recurrent C. difficile infections. So people who have a really bad colon infection, we know that it works. And then we're kind of expanding the indications for FMT to things like IBD and so inflammatory bowel disease. And they're trying to work on other things too. So they're thinking that it can cure neurologic diseases and other gut diseases. And honestly, our gut microbiome is so amazing. Like I think we have a lot more to learn about it, but I really think that the flora, like the good bacteria in our guts, has a lot to do with our health. Like has like everything to do with it. I've actually had a couple patients come and tell me they tried to do fecal microbial transplant at home.
No!
Really?
DIY.
What maniac is doing that?
Yes. It was in the New York Times a few years ago, like on the health stories. And so people have been telling me they got like, you know, their, you know, close family relatives took their poop, put it in a blender.
Oh my God.
Put it back up their butt. And then they come tell me and they're like, hey, you know, I don't think that worked, doc. And I'm like,
you think?
So there's a right way to do it and there's a wrong way to do it. And the DIY like that probably isn't going to work.
I mean, I can't imagine. That's just the arrogance of someone like, I got this. Like, that's so fucked up. I mean, you're like, why go see a doctor that, you know, is trained in like, you know, there's like a whole process, but let me just do it in my blender. Also, like, hopefully I threw the blender out.
Yes.
Or like, this is my special poop blender.
Yeah, poop blender. Oh, that's so foul. Wow. That's insane.
Okay. But so what is the proper way to do it? Like, how do you find a donor?
Yeah. So if you're going to find, you can have like a patient-specific donor. And so in those, like the studies have shown that it should be like a younger person. You know, sometimes it helps if they're a close relative because then you might have the same DNA. And then, you know, some more recent studies showing that they should be in your local community because like the food you eat, the air you breathe, the water you drink probably has the same microbiome versus someone who's like in California.
Right.
So there's that. But otherwise, most of the screening is just it should be a younger person, like never had tattoos or like hepatitis or HIV, like or any kind of viral disease that can be transmitted.
And when you say younger, like how young can you go? Because my nephew is 5, so
I know technically it's between 18 and 65, but I have heard of people who were younger and donated.
Oh,
like kids, yeah. And then so they actually mix it up in a lab and they actually like filter out all the pathogens and then squirt it. They actually also use a blender in their lab. They blend it into
specific blender.
It's a poop blender. Yep. And
It's like an Oster
put it
one
into
from Target.
little vials, and then they shoot it up during a colonoscopy, or put it in through a tube in your nose that goes bypasses your stomach, goes straight into your gut. So those are the proper ways to do it. They're also working on a capsule, so like a little pill that has like a concentrated form. I haven't seen anyone use that yet, but I have seen that in the pipeline.
I think I'd want the pill. I don't think I'd want
Me too. I wouldn't.
I don't want the nose
I would
thing.
do the pill.
The nose thing just sounds like if there's an accident that goes awry, like just no way.
It would totally be amazing if someday it was just like everyone had an FMT pill that would be like kind of, maybe engineering your own microbiome to be what it's supposed to be. Like that would be awesome.
I feel like I read about that, like not that particular thing, but the idea of like a pill designed like future like medicine, like it's designed for your body in a sense where it's like
medicine,
you just kind of like swallow it and it just sort of takes care of whatever it needs to take care of. But I would definitely go for the pill version. I would not want, or the butt, either one, but not the nose.
Colonoscopy, knock me out, and then have Dr. Fong do it professionally. That's the only way. Yes.
Right.
No DIYs.
No. No turkey basters.
No turkey basters. No like just going to Target and looking for a shit blender. That's just awful. Oh my God.
Mind blown. Oh, talking about pills, I heard years ago that because it's really hard to see your small intestines.
Correct.
But there's like a pill that has a little camera that you can they can go then. And have you used that? Do you know,
Yeah. So mostly it's a gastroenterologist who will prescribe that, but it's called capsule endoscopy. So you're right. The small bowel, it's hard to get into either through your mouth or through your butt. And so that kind of little small bowel portion in between, we end up having to do one of two things. The capsule endoscopy, which is a small camera, it goes through your entire small bowel and then you poop it out. So it wirelessly transmits the images, right? Yeah.
That's so cool.
Which is awesome. And then the other way, though, is sometimes the images aren't so clear, so it's almost always like a last resort thing. The other way is to do what's called a push enteroscopy. So you go through the mouth, but then someone has to kind of help you either through your abdomen, like laparoscopically, to kind of pull the scope through the small bowel. Just because it's very long and Yeah,
because the small intestines is like many, many feet.
Oh, yeah. Yes. Super long. Yeah.
Yeah.
That's crazy.
Wow. I've always heard of it, but I never knew. Like, it almost seems sci-fi. Like, it doesn't seem real.
Yep. Capsule endoscopy. Yep. It is a thing.
Wow.
I feel like I saw that in like not Scientific American or one of those like magazines. They had like a little picture of it, but it was like 3D. It wasn't like the actual camera. I feel like I saw it like a long time ago. But very cool stuff. Regardless.
Yeah.
I hope I never have to use one, but
exactly. I hope you guys never see one.
I would like to see pictures of somebody else's, though, just for the podcast.
True. Speaking of pictures, I got a better picture for you, by the way.
Of my insides?
Because for whatever reason, that day the printer was just not working well, and so we got a better picture for you.
Oh my God.
I'll send it to you.
Yes, please. I want to post it with this episode. I literally, when you guys walked out of the room, I took pictures of everything, and then I was texting friends, and I was like, this is the inside of me, and this is the scope that went inside of me, and this is the machine that I watched it on live. Like, I literally just laid there and watched everything. And the funniest part up to the whole thing is you literally see my butthole, because the camera is turned on way before. So you see my butt cheeks, butthole, and then you're inside. And I was like, whoa, that's very graphic.
Yeah. It's kind of awesome, though. Like, I love that you love this stuff, because it really normalizes it and makes people be like, hey, what is the experience you get when you go into the doctor's office to do one of these things?
Oh, I'm all about normalizing it, because if we can, if all of us, especially you, can help prevent any kind of cancers and disease,
correct.
I think that's just amazing. I'm not saying our podcast is saving the world. You're more saving the world being a doctor. But
I think you guys,
I just like hearing the shit stories. No, this is important, though, obviously.
Yeah. No, you guys are important.
And so what's the best diet for colon health, would you suggest?
Yeah, so I tell all my patients the same thing: 25 to 35 grams of fiber a day. And and I think to you and I, it sounds so normal. Like fiber is, fruits and vegetables and like beans or legumes and oats and, but people will ask me like, Doc, what is fiber? Like, and still, middle-aged people will be like, what has fiber in it? Do potato chips have fiber in it? I mean, that would be a very, very small amounts of fiber, but so it's good. Like, I like having this conversation. So like, yeah, so fruits and vegetables, a little too much fiber, and you can get things like, and actually you can get more constipated, you can get things like bezoars. So bezoars are actual fiber balls that can get, trapped either in your stomach or in your colon, and it looks like a tumbleweed of poop that just gets stuck there. And those need to come out, usually manually or colonoscopically. And then, as you know, too little fiber, then people get constipated and then have all kinds of problems.
Yeah.
So...
But and then fiber also goes well with water.
Yes. So 64 ounces of water a day at least. If you're not drinking water and just having fiber, you will still have, constipation problems because you need water to wash it all out.
Yeah.
And then a good balance of like carbs and fats and protein. So I've actually had quite a few patients who came in and they're like, oh, I'm on an Atkins diet, I'm on a South Beach diet. So things that are high protein, suddenly they're eating less soluble fiber and then they get constipated. So that happens too.
Yeah. Oof. So balanced diets.
Yep.
And you talked about doing like this, like a wand to help my hemorrhoids instead of banding them. But then you were like, if we did this, you have to take psyllium husk every single day to make sure that you're having more looser so you don't ruin the work that we did. And what was the wand called?
It's THD. So it's transanal hemorrhoidal dearterialization, which again has been around like for 15, 20 years. It was invented in Italy. And what it does is it Dopplers the blood vessels that go into your anus. And so there's actually like between, most people have between 3 and 6 pedicles and arterial blood vessels that actually go into the anus. And when we find it, there's like an ultrasound, it finds the blood vessel, and then we're able to ligate it, which means that we sew it up so that it doesn't bleed anymore. And then it also tacks up the tissue. So it kind of pulls everything up, like pulls your anus up so that not everything is falling out. It works pretty well. It stops bleeding. It stops like prolapsing hemorrhoids, so hemorrhoids that fall out. The only thing is, I always tell people, there's still slightly higher chance that they will recur because the gold standard is to cut them out. But the problem is the cutting is super sensitive, and it's a super sensitive area. It really hurts. And I tell people, if you don't have to do it, don't do it. And I'm a surgeon, and I'll tell you that. Hemorrhoids suck, and I would almost never want hemorrhoid surgery.
Ugh. Yeah, I mean, like, just the idea of, like, not, like, having that and having to go to the bathroom after a surgery.
Yeah.
Like, that whole thing just blows my mind. I'm like, oh.
So, like, the constipation afterwards, like, why I told Ellen that is, I don't want you to break the stitches. That's all. So just have, like, a good soft bowel movement so it doesn't break the stitches. Most people who have been having hemorrhoids for 10, 20 years and kind of were embarrassed to see anyone about it, they've been having such bad pain and bleeding anyway that, after surgery, they're actually like, oh, this is totally fine. It's way better than what I was experiencing.
Wow.
And so usually they're grateful. Yeah.
Incredible. That's nuts.
And you were talking about prolapsed hemorrhoids. Have you done any prolapse butthole surgeries?
Yes. So prolapse rectum. Yeah, so the rectums can actually prolapse quite a bit. Oh, I actually didn't think we were going to talk about this, but...
you have to if you don't want to.
No. Rectal prolapse is a very real thing. It's a very different thing where the entire rectum can come out of your anus and it can look like an elephant trunk sometimes.
Shit.
Yeah.
Oh my God.
You guys are still processing, okay.
That is, wow. I wish I had an elephant sound effect.
Edit it in.
I know, right? I don't have that. Oh my God.
No, but it's awesome too. Like, again, those patients are so grateful after surgery because you can do it 2 ways. You can either do it like laparoscopically, robotically, where you're on the inside and you pull it back up and tack it back up. Or, you can do it outside or like transanal, perianally, where you cut out that excess portion and then sew it back up. But afterwards, people have such relief from it.
Yeah, because we interviewed Brandon from Rieger, which is a fisting site, and he likes to call them a rosebud. And the fisting community really likes prolapsing, and I'm like, why? Like, it's funny how they fetishize your elephant trunks.
Yeah.
I mean, I don't want to yuck anybody's yum, but at the same time,
That's horrible. I'm sorry.
Yeah, it sounds painful.
I'm so square. That's like just.
I can see how fisting might make that worse. That's all.
Yeah, I mean,
you're stretching the anus, and that's the whole problem, is that it's coming out.
Oh my God.
So what is on average something that makes a prolapse happen?
Oh, that's a good question. So usually it's chronic constipation, or it's just your genetics, like it's just your body. So people have like a redundant rectum. So like it's kind of loose, it's kind of floppy. Again, it falls out, and then chronically falling out over time will stretch out the anus, which makes it stay out.
Wow.
Yeah. And again, in older women, it tends to be more often. So women who have had multiple babies, like vaginally, and they have a looser pelvic floor. Like that's the entire thing. Yeah.
Wow. So do Kegels and exercises like that really help?
Kegels, I think Kegels help. And actually there's also the opposite end too. So Kegels for the back end is what I tell like my older patients to do. Mm-hmm. You actually have to go to a physical therapist, and they'll tell you, squeeze your butthole around this balloon, that kind of thing.
Around a balloon? Wow.
Yeah. Initially they do the test around a balloon to test your squeeze pressure.
Wow.
It's like feats of strength.
Yeah.
We tried out that chair that Dr. Goldstein is like, have you heard of that chair that is like electro pulses into your butthole to tighten it up?
Yeah.
It's pretty
you guys
amazing.
Tried it?
Yeah, we
tried it at ButtCon last year. It was intense.
Yeah. It looks like something out of Star Trek. Like the chair itself looks like a Star Trek chair. Yeah. But I mean, I think they said, I forget how many, what was it like? Is it the sessions were like 28 minutes or something like that, and it was the equivalent of like,
that was long.
I don't know, tens of like 1,000 Kegel exercises like within like that one, whatever the number was. It was ridiculous. And but they use it for a lot of people, that have that kind of issue. And also for tightening. They were saying for tightening in general, for women. Yeah. But it was like so the sensation was just like pins and needles a little bit. But
I can't imagine.
Yeah.
It's so funny.
It was. You liked it? Pins and needles?
A little bit, yeah.
Oh.
Initially.
For me, I thought it was surprising because the chair was so beyond flat. There wasn't any cushion to it. There wasn't any curve. And it literally felt like when it was coming on, there was like a cone of energy going into my butt.
Wow.
For me, it felt like when I get acupuncture, they do the acupuncture with the stem, the stimulation stuff. That's what it felt like almost. Like I was getting this pulse of like. I want to try this
just to see now.
It was pretty cool.
I was happy to try it. I would totally try it again. They were saying, they were all excited. They were like, "You're a woman. Some women have orgasms on it." I was like, I do not want to have an orgasm at ButtCon. I'm like down to do it for the podcast. I'm not interested in being so public with my orgasm.
It did not happen. It did not happen though.
You told me, and I am very excited about this, that you have done surgeries where you've taken things out of people's butts.
Yes.
So we want to know all about this. What you pulled out? What are the common objects?
Yeah, like we were writing these questions. I'm like, yes, I need to know all of this. And real quick, before you start answering these, I saw on Reddit a bunch of like butt different subreddits where doctors were like, anonymously like talking about like things they pulled out of ER sessions, and it was wild. But anyway, sorry.
And I want to know the excuses people give too, because
I slipped.
Just be honest.
Yes. No, I want to say that probably I pulled things out of people's butts more often than I would have liked in my career. But,
sure.
Yes, absolutely. And like, obviously, like, remaining sensitive to victims of trauma, like who are like actual victims. But I will say that the majority of the time, that is not the case. Like way not the case. So the most common thing is dildos. Like number one is dildos. And the biggest one I ever pulled out was like an 18-inch black double-ended dildo.
Wow.
And the excuse is always the same. It's doc, I fell on it. I sat on it by accident. I was doing something else and this ended up my butt. Like, but actually,
it doesn't work that way.
I love. I sat in an 18-inch double-ended dildo by accident. It was just sitting upright in the couch. I don't know what happened.
Yep. Like, I sat on it.
Yeah.
Other things, cucumbers, drink bottles of all sorts. One time there was a screwdriver, which I think is suspect, like the wrong end of it. And what was the other thing? A highlighter very recently, one of those big pink highlighters, a candle, those longish votive candles.
Whoa.
And, but always, doc, I sat on it by accident. I don't know how it ended up here. The problem is, though, that people don't realize, you kind of put things up your butt and then your body has this like negative pressure. So once it's in there, it gets like sucked up in there and it's like really hard to pull back out. Like usually we end up having to go under general anesthesia and then your body relaxes and we pull it out. Oh, wow. I've heard of people putting in mice and gerbils. Fortunately, I haven't freaking seen that yet because I would probably just die. It is a medical disease. I learned of it in medical school. It's called formicophilia. Like you like having objects, like moving things in the butt. There was that famous Richard Gere story.
Yes.
I don't know if you guys
that was the big rumor, right, for years.
Yes,
like he was like
Okay, number one, those people should be arrested for animal cruelty.
Yes.
Because the animal has to suffocate after a while.
Yeah.
And number two, there's things called vibrating butt plugs out there, people.
Yes.
You can stimulate this without hurting any animals with a nice taper on the bottom.
I imagine someone that would argue would be like, I like the real deal.
No.
They're like, yeah, that's cool, but I like knowing that it's that's a whole level of like experimentation that I am just like.
I
like,
do think people are probably somewhat high when some of these things happen. One time I found a bag of cocaine, which that one was a little scary too because like it started to erode. Yeah.
Oh, that's not good. That cannot be good. Wow.
Yeah. No.
Oh, I just sat in this by accident, or I'm a drug mule. Like, wink, wink. Please get me out of this.
Yeah. Wow. Yeah, besides like the obvious, like you should be using butt plugs with tapered bottoms, but like if you were to use it for an object, if like a cucumber, does that eventually like your stomach acids digest it? Or
yes, yeah. So yes, actually, so this is not one I've seen, but one I've heard of. So by proxy, someone put a narrow squash, like a kind of gourd, up their butt, and so over time it was in there for like months or something. I don't even know how this is possible. So it slowly got digested. Now I think it would happen, but in most people I think that you would have problems, like you would have, you wouldn't be able to poop and you would get an infection before it actually got digested completely. So my point is, I always just tell people, don't let go. Like, just don't freaking let go.
Yeah.
Hold on to it.
Yeah, that's pretty nuts. I mean, a gourd. I just...
We had one guest on the podcast that we actually turned it into a cartoon, so I can send it to you if you haven't seen it, who got a double-ended dildo stuck up his butt. And they told him, we're going to knock you out. We're going to try to take it out through your rectum, but if we can't, we're going to have to cut you open and you'll have a colostomy bag for a while. So how often is it, you said it's usually when you give them anesthesia, it relaxes, you could take it out the rectum, but how often do you have to maybe actually go into surgery?
There was only one time. One time we couldn't get it out. So like 99% of the time we're able to get it out. As long as you're under anesthesia, your body relaxes, your anus relaxes, and we just take a very long clamp, or I send one of my interns, and she goes in up to her elbow. Most of the time I have to grab it actually. And it comes out. Yeah. Like almost 99% of the time. Only one time can I ever think of someone got a colostomy for it.
Wow. Yeah. And what was that object?
So that was the cocaine. And it was because there was like probably a perforation in the colon just because it had eroded through. So that's the danger. It's not that things get stuck in there, but that something sharp could kind of poke through the colon and then you would need emergency surgery.
Oof.
Wow.
Yeah.
I love that you're like, I sent my intern in. It reminded me, there was a whole thing about that, like interns and like what were like the worst jobs they had to do. And then like, you know, just
so we make jokes about that. I'm always like, oh, send the intern to do the fecal disimpaction and stuff like that. But I actually find it super satisfying. So most of the time I will just do it myself, and they'll be like, oh my God, Dr. Fong, how can you do this? So the most common, besides dildos, that you have to pull out of people's butts is actually just poop. So like people who have like really bad like anal pain or proctitis, or old people and they don't want to poop and they get impacted, and it's like rocks in there. Actually, I had one patient who was like kind of younger, and he just had chronic constipation, and it was like rocks. It was like a literal bag of rocks.
Oh my God!
Of his butt. Wow! But then they feel so better. They feel so much better afterwards. Like I'm always
completely.
Oh yeah, I mean you're their hero at that point. Yeah. I would like be like, thank you.
It's funny because I lost my sense of smell during COVID for like 5 months, and so I couldn't smell anything. Like couldn't smell poop, I couldn't smell pus or anything for 5 months. And then about a month ago, it came back, and it came back with a vengeance. I was disinfecting someone in the operating room, and all of a sudden I was like, I can smell again. I am.
You're like, it's back.
Oh my God.
It is
I was
back.
Like, oh shit.
I have so many questions. So fecal impaction, like how we've done news stories where people have died from it. Mm-hmm. Like if you're constipated for X amount of days or weeks, when do you really need to see a doctor? Like, I mean, for me, it's 24 hours, and I'm like, if this isn't getting out of me, I'm upset. But like, what do you advise people about constipation?
Yeah, so it really depends. So I think that if you really have not had a poop in over like 4 or 5, like, and then the max that really pushing it is like 7 to 9 days. Some people will tell me they haven't had a poop for 7 to 9 days. And this most of the time, like I said, occurs in people who are like older, they're immobilized, they're in a nursing home. They actually can't tell you if they haven't had a poop. And then their bellies get super bloated and like a balloon. And so at that point, yes, definitely go see a doctor. But otherwise, like the range of people pooping is so variable that it's like, you know, people have a poop once every 2 days, once every 3 days, and that's still kind of within the range of normal. You know,
three
and then
days would
obviously
be nuts for me.
the quality of the poop, you know, which we're always concerned about.
3 days would be nuts for me if I didn't go to the bathroom for 3 days.
Yeah, I couldn't do 3 days, but people do. And 3 days is their normal. I
was in the hospital for a broken leg, and I was for 2 weeks. And my doctor had just gone on vacation, so I had to wait for a week to do surgery. I broke my femur when I was like 15. Oh. Yeah, I mean, it's fine now. But back then, like, I just remember being in the hospital, and I did not want to go to I was just so, like, I mean, like, 15-year-old, like, I can't have anybody see me, like, first of all, just being, like, laid up like that was a nightmare. But having to deal with going to the bathroom, I'm like, I think I can go 2 weeks. I just remember saying that in my head. I'm like, I think I can go 2 weeks. And they're like, have you gone to the bathroom yet? They're like, no. And then, like, after one whole week, I finally went, and it felt like I was passing out like a football. But but really, when I looked, I mean, my leg was still broken. They had to put my leg up on this thing, like they had the little bars on the side for the toilet. I kind of peeked back because I'm like, I have to look at this. It was just so painful, and it looked like a marble. It was so small. And I felt like going, that was it? Like, that was this giant, and all I kept thinking was like this weird, like, lump of coal, like, it just crushed down to, like, a diamond. I mean, it was nuts. It felt, like, so painful, and it was this little tiny thing.
I'm sorry to hear that.
I mean, there's a long time ago, but yes, thank you.
Were you on painkillers too, Dave?
No.
Because I know painkillers make you constipated.
They do.
I mean, I'm sure whatever they were giving me, I was on a drip because I lost a lot of blood, and I had a blood transfusion on top of that.
Oh, my God.
But before the blood transfusion, I was just like passing out left and right. Every time I kept moving the bed up, I would just like, I get to a certain angle and I would just like pass out.
Wow.
And then
I bet you were on a painkiller because that will definitely constipate you. And then also the immobility of
just sitting in the bed, like, and then it was just so embarrassing. You have to like flip you over and everything's super painful, and then like they have to wash you, you know, so you don't get bed sores. And that was only for 2 weeks. Like, I was there for like a short amount of time, but once I got but once you get the surgery done and I had I was like brand new, but it was this trippy, like the whole thing, like just, you know, but that was weird.
It's pretty crazy, like the human body's capacity to hold poop though. So, you know, kind of little kids, when before they're potty trained, they actually don't know. They're like, oh, it hurts. Like, I don't understand how my body works. And so if you're starting this from a young age, it can be behavioral, where they're like, oh, I don't want to poop. And then even like older people, they can be like, oh, I'm holding it for like, 8, 9, 10 days. So I did a study once on, there's this thing called megacolon. So the oldest known history, if you've ever been to the Mutter Museum in Philadelphia, is this guy in the 1800s. Have you seen the megacolon?
I don't know.
Yes.
I don't remember that now.
40 pounds. 40 pounds of poop.
Yes. Oh my. Oh, I do remember that now.
40 pounds of poop in that guy's colon.
Oh. Wow.
That's such a great museum.
Yeah, it's a great
Everybody
museum.
loves to go when
40
things
pounds.
are opened up again.
Yeah.
That is nuts.
Going back to you losing your smell for 5 months, so you had COVID.
I did. Yep.
Do you know how you got it? Like, because they say that COVID is in poop.
Yeah. No, I didn't get it from poop. Not that I know of. So I got it pretty early, like right at the end of March. And this was just when things were starting to happen. And, news about COVID from, Canada and from China were coming in. And I was in the hospital. I was seeing a couple of patients, and there were a couple of patients in the ICU who were coughing. And I think one of them coughed in my face, honestly. And I think that's how I got it. So 2 weeks or slightly less than 2 weeks later, I got sick. I had fevers and like just the worst fatigue I've ever felt, shortness of breath. And then my partner got sick too. So she works in the health department. They do like COVID test and trace. And so at first I thought she gave it to me, but I'm pretty sure I probably gave it to her. She lost her smell for like a week, but mine was like 5 months.
Wow, that's a long time.
Did you have your taste?
I could taste. So it was weird. I could taste things like sweet and salty and spicy, but things that were kind of like finer, like floral taste, or like strawberries. I couldn't really taste the strawberries, or like, the smell of tomato leaves, which is like one of my favorite scents. Could not smell that at all.
Wow.
Yeah.
And then
It's people have said that COVID could be even spread through farts. And I was like, what? No, I don't think it's that easy. Especially we wear clothing, and we actually, I read this book called Fartology, and part of the book was there was some scientists that did a study of a guy who farted on a petri dish with clothing on, and then farted on a petri dish naked. And the next day, the clothing petri dish had no bacteria on it, but the naked one did.
Oh.
So farts can
totally,
have bacteria, but clothing will filter it out.
Well,
Sure.
yeah,
I mean, it would have to be a pretty wet fart.
Yeah, pretty wet. And it's like you have to literally fart in someone's face naked, right. That would.
Even earlier on, like in February, they were saying that COVID can be spread in stool, but it's a low percentage, and you would really have to be all up in it for you to get it.
Some digging.
Yeah.
My favorite was when the New York State of Health put a thing about saying about sexual positions, and they were like, no rimming.
Yes.
And I was like, who decided that rimming was okay to go into that word?
Yes.
Really?
I remember that. Yeah.
Yeah, that was hilarious. They're probably like, you know what? We're all adults here. Everybody knows about this.
I will say that probably people who were rimming probably have the cleanest buttholes of anyone anywhere anyway.
Probably.
Totally.
Yeah. They're like, this is not for me. This message is not for me. Oh my God.
And last, but unless you want to add some other stuff to what we're saying, or Dave, you have any other questions, we always like to ask our guests about what kind of toilet paper you use, and if you put it on the roll over or under.
Yeah. So I was always an under, and then I met my partner of 16 years, and she's always been an over. So we go by what she says. So now we're an over.
But and deep down, you're under.
Yeah. But actually, the over makes more sense to me now. I can see why that's the case. So, I want to know what you guys
don't let your partner bully you. That's just
but for branded toilet paper, during the toilet paper shortage of 2020, it was just whatever we could find at Costco. So we loaded up on Charmin, which I like. It's okay.
Cool.
Yeah.
I'm an over and Dave's an under. And I need to still tally up every single one of our guests to see. He thinks it's like 95 to 5% unders, and I think it's more like 80-20.
No way.
Yes, overs are a lot more than unders, but every time there's an under on, Dave gets so excited. He's like high-fiving when we're used to
now I'm just like, I get to the point now, I guess for the sake of the show, it's better that I'm an under, but I guess outside of the show, I just don't even care anymore. Sometimes I just put the roll.
He's a liar.
I am not. I put the roll on the other day, and it was over. I'm like, I don't. Like, do I even give a shit?
So why are you an under then?
Well, I just like the way it looked. I thought it aesthetically looked better. Also, the over thing, that everybody's like just so like into. It's like a waterfall. So if you accidentally bump into that, and if you have like one of those like loose rolls, like
that's true.
It spindles. It's cascading down to the ground.
Or if you have a cat who likes to play with the toilet. Cat
was a big thing. We at the time when we had 2 kittens. Like we have one cat that's like 18, the other one passed away. Oh. But when we got them together, they were like super crazy, and although they never did it, we were always freaked out that we were just going to come into the bathroom and see the roll on the ground. And my friend's like, you got to put it under because like they'll have a harder time getting to it. I'm like, all right, I just kind of stuck. I like the way it looked better. But now
it does look better.
I definitely think it looks better because it's just like out in the front. I don't know. It just.
But someone told me the over thing, is that if you have like toilet splash, it doesn't get onto the squares that are on the backside.
Toilet splash.
And I was like, oh,
where's that?
Actually, that makes sense.
I get, but where's
unused squares, right?
Right. Yeah, I guess so. I mean, I just trying to think like where the toilet is situated compared to
that's true. I guess
to the if it's really low, I'd be like, okay, yeah, that could be a problem.
Right. Yeah. I don't know.
Then I think I would just put it. I think if that was having that issue, I'd be like, I'm just going to put it behind the toilet or something.
Yeah. I don't know what people do. Yeah.
That isn't possible.
Oh yeah. When I'm in an apartment and it's behind, I'm like, what the? Why is it back there? It should be as easy to get to as humanly possible.
Yes,
agreed. But there's times I'm just like, I just don't even care. Sometimes I'm in a hurry. I'm like if I'm in a hurry and then my wife forgets to put the roll on, and I'm just like scrambling for like the spare one. I'm just like, I just need to get this thing on. I don't care how it is like how it adheres to the wall, and I'll deal with it later.
People who use up the roll and don't replace it are barbarians.
Yes.
I'm so annoyed by it. Like, so disrespectful. It takes literally 3 seconds to
I don't mean like when it's like
so
like
if you
nothing.
Finish it, replace it.
I mean like when it's like you got like maybe like one pull on there, like one little time, like not quite empty, but like just change it up.
Although your one pull might be different from someone else's.
Completely.
Exactly. Yeah.
Yes. So it is.
I do love bidets, though. I think I've told Ellen that I love a bidet, and I wish we were all European so we could all have bidets.
Bidets are the best.
Yes.
We're
and
all about bidets.
They're becoming a little more popular here with the like ones that are easy to snap on.
Mm-hmm. Yeah.
Yeah, I really enjoy a bidet. Like they're fantastic.
And bidets were like selling out like crazy during the paper shortage. So
that's true.
Yeah.
Yes.
A lot of places were sold out at the beginning. So people were getting hooked on it. They got it.
Yeah. I mean, I love them. Yeah. So more bidets.
Save your butthole. Use a bidet.
Exactly.
Exactly. And Dave, do you have any extra questions for
No, Carmen? I mean, Carmen, you told us everything. I mean, everything I want to know anyway. The whole like pulling things out of things. No, that's what I wanted to know. I was like, whoa. Very fascinating.
I have one more question. During colonoscopies, I heard that back in the day, if people had methane gas built up in there, that things could actually explode. Is that like an urban legend?
A little bit. So yeah. So right now, most of the insufflation is with carbon dioxide. So you really aren't going to light anything up unless you're really burning something. And even then, no, that almost never happens. Maybe at the very beginning, but no.
We did a story about that.
Up in there, you burning off the polyps with carbon?
No, you burn off the polyps with electrocautery. So you kind of like, either snare it or grab it and pull it off. And then if you have to, you can actually burn the base a little bit so that it gives hemostasis. It stops the bleeding. But what I'm saying is you actually have to insert or inject air into the colon to inflate it so you can see. And that's carbon dioxide.
Yeah.
That pushes out all the methane.
Yes.
We did a story, and I thought it was the one doctor actually was commenting on the story. It kind of was calling a little bit of bullshit on it, but I forgot where it was. I think it took place in either Korea, South Korea maybe, but they were saying that they were doing someone like a fart got lit on fire while they're doing some kind of laser surgery. And this one doctor's like, okay, like in theory, yes, that might happen, but the odds of that happening, because like the person like got their leg burned, like their part of their butt, like it was like this whole thing. Yeah. But this one doctor was like reading the story, was kind of like laughing, but also like, I don't think this is real.
Safety.
And like there would have to be so many like factors to make that like actually happen.
You would have to have the perfect storm. So there are like fire safety hazards in the operating room, but most of the time it's actually with like, you know, head and neck surgery, because you're oxygenating, you know, with an intubation or with a nasal cannula, and oxygen is what catches on fire like really easily. Or the other thing is the prep that you use. So like the chlorhexidine, like the alcohol solution that you're cleaning the area with, that stuff catches on fire. I honestly haven't seen any farts catch on fire, and hopefully never will.
Yeah. Wow. But I mean, for this podcast, we were like, we have to talk about this. But it was really like, I was like, what?
That's crazy.
Yeah.
Have you? I actually have heard that deli meat, if people who eat a lot of deli meat are more likely to have colon problems. Is there any foods that you would suggest to stay away from?
Yeah, so that's a good question. We were just talking about this the other day. So a lot of studies have shown nitrites, so things that have preservatives, preserved foods, and carcinogens that are from overcooking and burnt bits. So I love bacon. You know, I think it should be a food group. Yeah. But I actually think I eat a little bit less of it, or I've eaten a little bit less of it in the past couple of years, just because it's both preserved and most of the time burnt to a crisp.
Yeah.
Yeah.
So those things are more likely to be alarming.
Yeah. I think one day we'll know like every single thing that can cause colon cancer. But for now, you know, I tell people at least do all the diet things that I told you, like the 25, 35 grams of fiber, avoid constipation, because that's another, you know, possible causative factor, is that just chronic constipation, just sitting in your colon and all that irritation and inflammation it causes. And then don't get constipated. You know, stay away as much as possible from like nitrites and carcinogens.
And constipation can have those, what are they called? The pockets?
The diverticulitis. Yeah.
Yes.
Yeah, exactly. Yep. You can get these little outpouchings in your colon that, you know, can be inflamed, or they can bleed. And diverticulitis is actually a really common problem. And the root of all these problems is constipation.
Wow.
Oh, I'm so lucky I'm not constipated.
Keep pooping, please.
Yeah. I'm so lucky I'm not constipated. That is like the worst. Oh.
Well, that's why my constipation is like, I was constipated yesterday, and I was like, I'm taking a Swiss Chris. I'm making sure this comes out of me. Mm-hmm. And I also didn't drink that much water yesterday because I was on a shoot with a mask on, and I didn't it was hard. Yeah. It's really hard, this whole pandemic thing.
It has been. It really has.
If anybody else out there has amazing questions for this incredible doctor that has helped my butthole, you can call us on our hotline at 203-998-5579. It's on our website, heypoopypodcast.com, or you can email us any questions too at heypoopypodcast@gmail.com. We can even have Dr. Carmen Fong on for another episode with all your questions.
Yes, do it. Well, if there's nothing more, let's get into some news then.
Yes.
All right. So I posted this on our Instagram feed, and it's from awesomejelly.com, which is hilarious. This is considered a news site, but I know. And all the author just says Chris James 11 Instagram. So that's how far we've come from journalism. But the story is really funny, and I just wanted to again. It's like I have to talk about it because it's fart related. But they're saying that farting in front of your partner leads to a stronger and healthier relationship. Now, this is like more of a fluff piece. I would even go as far as to say junk science. But again, I like the idea of it. There's some relationship guru named Cynthia Powell, who is apparently very controversial. I have never heard of this person, but she was on an Irish late TV chat show and had mentioned that, you know, couples that fart in front of each other usually like stay together longer. And they said once the couple gets over the initial embarrassment of farting in front of their new partner, it seems to open up a whole new period of openness, honesty, and trust. Now, I will say that I guess like if you can get over that part of like, especially if you're like in a new relationship and you're farting in front of somebody and they're cool with it, I think you're off to a pretty good start. I mean, most people aren't going to be uptight about it. But I feel like if you do have a person that's like, what the fuck? you might run into some problems. So there's a little bit of like truth to some of this. So
let's do a mini survey. Dave, do you fart in front of your wife?
Yeah. I've been married for like 11 years.
Does she fart in front of you?
Yes.
And how long have you been together?
19 years, and we've been married for 11. So.
Wow. So there's a yes to that truth right there.
Yeah, but I mean, like, again, like, we're both of the people, like, I'm not going to let a fart be like, I can't be with this person. I mean, like, if you're, like, going that low, like, I get it in the beginning. Maybe you want to kind of keep a little bit of a, hey, I don't do that sort of thing. But, I mean, Jesus, after 11 years, we're still doing that. It's just like, let it go. Like,
yeah.
And what about you, Carmen? You've been with your partner 16 years?
16, almost 17 years. And yes. She told me not to say this, but we do fart in front of each other. Yes.
Yeah. I mean, come on. Ellen, I know you fart in front of Gerald.
It's like it's not unsexy though. Honestly, it doesn't really bother me that much.
Yeah.
Yeah.
As long as it's not directly in your partner's face when you're having sexy time. Right. I think like otherwise it should be my partner and I have been together 9.5 years, and I would say the first 5 years of that, every time I farted, he was so angry at me. Like I have literally shit on our relationship. And now he's just like, oh, you've broken me down. I'm done.
That's awesome.
And I used to be so insanely gassy. Like my entire upbringing, even as a baby till I had chronic Lyme disease, I was insanely gassy. So I was like, if you're going to live with me, it's going to happen. I can't be in a small New York City apartment without farting.
Yeah.
Oh, he definitely won the lottery on that one. He's like, Jesus. Never met anybody this gassy before. He's like 1 or 2, but now it's just like.
But where's proof in the pudding? The three of us have been together. I've almost been a decade. Dave, you have 2 decades under your belt. Carmen, you almost at 2 decades.
Yeah.
Like farting is okay, people.
Yeah.
I like how you were like at the beginning, you were like, oh, I don't do that kind of thing. But it's just so funny because I did that too. I was like, oh, I won't go to the bathroom.
Exactly.
I won't do anything. I'm just going to pretend like I don't fart, I don't shit. But I mean, everybody does.
There comes a point where you're going to be like, I have to go to the bathroom right now. You're going to hear or you're on vacation. You're going to hear some things that I would rather you not hear. But, I think that's when it first happens. You go on vacation. You're like, oh, we're like the bathroom's right next to the bedroom.
Yeah.
So it's just like, okay, well, you signed up for this.
The third time I had sex with my partner, he farted so loud that we both stopped for a second, and then we were like, okay, let's get back into this. And like we didn't talk about it till a week later, but I was like, dude, you broke the wall. Like you started the farting, and the farting is like before that I was really trying to keep him in, but it's over now. So
I would never bring that up. I'd be like, what are you talking about? In the beginning.
He brought it up. He was like,
okay.
So the other day I like farted. I was like, yeah, the whole neighborhood heard that. Like, really?
Oh my God. Well, yes, if you fart in front of your partner, you got to keep her. And if we're cool with it, you got to keep her. So. But with that, Carmen, thank you so much for being on our Poopy show.
Thank you so much for having me. You guys are wonderful, and I love what you guys are doing.
Real quick, where can if people want to get a hold of you, or like where can we find you?
So the best way is actually my Instagram account. It's Dr. Carmen Fong, and you can message me there if you ever have any questions. And then my main office is in Union Square. So should I give you a phone number?
Sure.
Call the office, 212-420-3960. You can always make an appointment with me there.
Nice.
I thoroughly recommend it if you're having butthole problems. She's now my favorite butthole doctor.
Oh, thank you.
Oh.
And I was like, and now I'm going to be friends with her too.
Well, thanks again for taking your Saturday out and then doing this for us.
Awesome. Thank you so much.
Of course.
Thank you so much. Happy pooping, everybody, and
Happy
enjoy
pooping.
your butthole.
Hey Poopy Podcast is brought to you by Perfect 4 Entertainment. Produced by Dave and Ellen, with executive producer Stormy Leather. Edited by me, Dave.
For more information, go to heypoopypodcast.com for episodes, merch, and more. Follow us on Instagram at heypoopypodcast and Twitter at heypoopy. Theme song by Jordan Perlson. Hey Poopy.